Emotional algebra, where the heart meets the math. What is integral is derivative as you figure out your path. Power plus emotions equals more than you can see. Listening to the wisdom of our host, Dr. E. Emotional Algebra with Dr. E.
Welcome to Emotional Algebra with Dr. E. Emotional Algebra is a podcast that helps listeners to understand the subtle calculations people make every day in their relationships with others. It's a podcast to help us all become better people through understanding the different variables that drive our behaviors. I'm your co-host, Andrew Tavani.
And I'm Dr. E.
Dr. E, we are back with another episode. It's been a while since we've had a guest on the podcast, but we do have one today. Exciting.
We do.
Yeah, so we have a man by the name of Jeff Boothman. Why don't you give him a little intro and then we'll bring him in.
Sure. Jeff is actually one of my fraternity brothers, so I've known him for let's just say a long time. Yeah, we've been through our college experience together and been friends since. And he recently, in the last years, had been through lymphoma. Experience with lymphoma, and is one of the positive cases of working through it and working through the recovery. Through the process, he's wanted to, as I always say in one of the Zen cones I talk about, is make medicine from suffering. He's definitely done that. His goal was to make the lives of people better who are experiencing cancer. And as a result, he wrote a book called How to Be a Cancer Patient. And I was honored enough to review the book and write the foreword for it and, follow his process through it. But he is definitely another person who shows resilience. And that's one of the things I think we've highlighted on the show with some of the guests that we've had on here, whether it was Chad Foster and even Andrea Tate and her experience of how she went through her issue of grief we talked about through the election stuff, but really finding people with a sense of resilience of how do we take life's challenges and grow from them, make the most of them, and then see how we can move forward to really try to benefit the lives of others. Whether sometimes it makes us unpopular in some ways, but people have the courage to share their pains, their experiences, their fears. That's why, to me, we're in all this together. And as you know, I've mentioned many times, and you being a part of this, that's really what we're here to do, is to help people create a place where people can share their emotions, their fears, their experiences, and really talk about them together so we can benefit all the viewers of the podcast and beyond.
Indeed. Well, let's bring him in here. Jeff Boothman, welcome to Emotional Algebra with Dr. E. It's great to have you here. Thank you for doing this. Really appreciate it.
Yeah, of course. Thanks for the opportunity. Like anytime I can tell the story and have an opportunity to help more people that are transiting their cancer journey, I'm all about it. So thank you.
So Jeff, if you could give a little bit of background into kind of what life was like before your diagnosis, how you felt it came on, and just for our viewers, lymphomas of different sorts are about 4% of the diagnoses. A little bit of information. Also, 1/3 of all people will be diagnosed with some form of cancer. I think that's a really important step, because what I hope people can get from this is, how your life can change so quickly, and then what do you do through that process? What are your support systems? How do you then work through it? And then there's definitely life after that, because the recovery rates are so much greater in the last, really couple decades, but they get even better. So I think we used to think of cancer in some ways, I know when I was a kid, as almost being a death sentence. It's by far not. And even if you look at Norman Cousins, who wrote a famous book on how he laughed his way through cancer, attitude is so much. And I think that's what Jeff will talk about too, is the support systems he had through this and the process. So with I'll give it back to you, Jeff, to kind of tell your story before and a little bit about what it was like in that diagnostic process.
Yeah. So for me, we were just finishing up building a house, and my wife and I was the general contractor on it. So that meant I was herding a lot of cats and doing a lot of work myself. And I had developed a tumor essentially right above my hamstring. And it didn't hurt. I felt tired, but of course you attribute that to going through all the work of building a home. So I'm like, okay. So I went to my general practitioner, and he's like, I don't know what this is. And he put me into the James Cancer Center, which he's like, well, I don't really know what it is, but we'll have you go there just to be safe. And I don't know if he knew or he didn't know. So the first experience was they tried to take a sample of the tumor. It's called a needle aspiration, where they can't numb you. They stick a giant needle in the tumor and try and get some tissue. Well, after my wife almost passed out watching that procedure, they managed to get it off to the pathology people, and they were like, we're not really sure what this is. So they scheduled a surgery to have it removed. And the plan was they were going to go and open up the area, take a sample, run it to pathology, a bigger sample, and then sort out what it was and then figure out what to do. Well, turns out, again, the pathology people were stumped, which at that point, I didn't really know for sure one way or the other whether I was sick or not and what it was. But the follow-up appointment with my surgeon, he made a comment that I caught, and he said, well, we're not really sure we're going to go do another surgery to remove it. We might just let the medicine take care of it. Yeah. I'm like, okay. Yeah, I know what the medicine is, right? And
yeah, Jeff, that's what I'm wondering. What did he mean by the medicine?
Well, chemo, right, is what he meant, right?
Right.
And, yeah, we'll do it a different way. So they eventually decided that they would remove the tumor, and then they once they got a clean diagnosis of T-cell lymphoma, then I was passed to another doctor, and then I went through 3 rounds of inpatient chemo. And those were 5 days, scheduled 5 days at a time, continuous. So you're lying in bed with a IV hookup the whole time. And then 15 rounds of radiation after that to kind of clean everything up. So
how often were the radiation treatments?
So those were every day near the end, short, really short. And honestly, for me, it wasn't awful because it was wasn't in kind of your mid body where it's really a lot more. The side effects are considerably worse. So in that part of it, I lucked out. But what struck me the first day I was in, I had exactly 0 treatment, and I was ready to lose my mind because you get yourself all kind of psyched up, ready to go. You walk into the hospital. Oh, well, we don't have a bed. And then you have to do literally probably 8 or 10 tests that nobody told me about. And then they put you on a bunch of steroids. So you can't sleep. You're lying in bed. They're pumping you full of fluids. You hadn't started treatment yet. So mentally, I was in a really awful place at that point. And what
would you say those emotions were? Fear, helplessness, overwhelm, terror?
Yes. I mean, it really all of those. The fear was 100% there. Overwhelmed for sure. And it wasn't overwhelmed with each of the things that happened to me. It was just the fact that I had no idea what was coming next. And I was surprised by a lot of the things that they wanted to do or needed to do. I had to have a heart test. I had to have another bone marrow draw. I had to have all these things. Nobody told me. So I figured I was showing up 8 a.m. or 6 a.m., whatever it was, Monday morning, start treatment, 4 days, off you go. Well, I had a whole day of all these tests, and then I got started. So you had a long time to stew. You had no idea what was going on. You really had no roadmap for how to manage yourself. And how to manage yourself as you were transiting this really complicated system of doctors and tests and, different people that you saw every single day. So, yeah, I was in a really bad place mentally.
What was your support system like? Did your wife feel like she knew how to support you? How were your kids doing through this?
Yeah, good question. So I had phenomenal support and really phenomenal care. Right. And so that wasn't part of the problem. It was really what was going on in my head. And I knew what I was doing and thinking and really concentrating on was not helpful. I didn't really know how to get out of it, at least initially. I just knew it wasn't helpful and I had to stop it or redirect it. So all the support in the world, the best care really for my type of cancer, really almost anywhere on the planet. But it's a really personal thing, what goes on in your head.
So what would you have thought if you would have had even a psychologist consult with you, or even just have so you have cancer video kind of thing, just to walk you through that?
100%. It would help 100%. Because I think everyone's journey is really analogous, right? Everyone has that same initial moment of terror, right? And then you have this whole series of thoughts that a lot of times aren't very positive, right? And then you have this need to go and manage your emotions so you can be active in terms of how you manage yourself through the system and the treatment. So to your point, having that as an opportunity from the jump would have been amazing for me.
You just used a really important word to me when you talked about managing your emotions and managing your process. And that is a much healthier word than what a lot of people want to say, control. I always say control is an illusion that's based in fear. And, as you understood, you had no control of your emotions, but in the process. So you have to work with, how do you work with the people, the emotions, the attitudes, the beliefs, and help yourself to find as much of a calm, quiet, ability to walk through this without stepping in a lot of the pitfalls and holes and fears that can come up.
Yeah, no, you're 100% right. 100% right. And I think part of the challenge is you have to kind of get through, for me, I call it get yourself together, but you have to get through that first kind of step where you can manage what's going on and manage the self-talk in your head to where then you're in a position to go and advocate for yourself as a patient. But if you can't manage that first step, you're never going to get to the point to where you can be an advocate for yourself through your care.
And Jeff, do you remember the moment for yourself that you sort of turned that corner and were able to advocate? Tell us about that.
Yeah. So first night in the hospital, walked around, and it was mid-December, let's call it, in Columbus. So it was cold. And I was able to walk around. I hadn't gone through any of the chemo yet. And I saw people and heard people in their rooms on the floor. And it was really bad. I mean, people moaning and crying, and it just really awful stuff, right? And I was at the time all hopped up on steroids because obviously when you start, they're not really sure what your reaction is going to be to chemo. And I'm lying in bed and I kept thinking all these terrible things. And the light bulb went off. It's just like, I can't do this, right? I was wearing myself out. I knew for sure 100% it wasn't helpful, but I wasn't quite sure what to do about it yet. And I think over time, I kind of got to the point to where it's like, I first scolded myself. You can't think that. You can't think these horrible things. And then you kind of, once you get through that stage, you try and figure out, okay, what can I do different?
And for you, so what was that?
So every time I would have a really negative thought, I would try and attach something to it to neutralize it or turn it around, right? So an example might be, hey, the survival rate for my type of cancer is 4%, but I'm a sample size of 1 and I'm going to be in the 4%. Or the survival rate for my type of cancer is 4%, but I'm at one of the best hospitals in the world and I have one of the leading experts, in that type of cancer that is available anywhere. So, and if you do it enough, you can't think the negative thing without attaching something to neutralize it at the end.
Yeah. So, I mean, it just sounds to me like you took a really proactive approach to counteracting all the negativity that you were surrounded by, even in there, and use that to, I think, like Dr. E said, at least manage the situation. You can't control it, obviously, but
Right.
to mitigate those negative effects.
Yeah. Yeah. Cause I mean, the first night I was in there, I was just spinning. It was terrible.
Yeah.
And you're on steroids, right? So you really can't sleep anyhow. Right.
Right.
So, I mean, it's just really bad. And I just knew that wasn't going to work. And there's really no place. I mean, Dr. E nailed it. It's like, look, if you could just give someone a support system in terms of a psychologist to help you from the get up, it would be a lot easier. Right. But I don't want to say every person, a lot of people feel exactly the same way and don't have that support system. So,
Yeah.
Well, I wanted to ask you about there are traits within you before this happened that you had the resources you had to pull on. So what would you say are some of the traits that you carried from your life, from your work, knowing you from, from college years and stuff? You've always been a person who's been pretty, I would say you've been pretty pragmatic. You're pretty matter of fact about things. And, so what are the traits? So, because what I want to help people to look at is, I don't want people to expect that they're going to have a tragedy like this, but I always say, plan for the worst, expect the best, and also inoculate yourself for some of these potential experiences so you do have a plan if you move into these situations. So what would you say are some of those traits that you carried with you in business and in life and parenting that helped you?
yeah, I think the first one is self-awareness. And for me, in a lot of cases, it's delayed. Certainly as I got older, I'm a little bit better at having that self-awareness a little bit earlier. But that I knew that what I was doing wasn't helpful. I just didn't know what to do about it. So I think there's that. And I think one of the other things that helped me, I took a course in graduate school about how systems work. And it wasn't a computer system. It could be anything. It could be an ecosystem. It could be how a parking lot fills up and empties. And it really has provided me with a structure of how to think about how things are operating. So for me, I looked at myself in this giant complex system of treatment with, I probably saw literally 30 or 40 different people every single day that were looking after me in some way, either giving me medicine or doing a checkup or what have you, right? And I think understanding that there's a lot to know about that, and there's a lot to know about it to be able to reduce my stress level, I think was probably the second step, right? So I knew I had to be a more productive thinker, and then I had to be more productive as a person, understanding exactly how all this works.
Mm-hmm. Mm-hmm. Okay. So from there, what are some of the things that your medical team did that you felt helped you through the experience? And what are some of the things the medical team may have done that you feel like set you back or, put you in even a more, perilous mind state?
Yeah, so I'll answer the first question first, or the last question first. It was not knowing what the steps were was awful. And I think that first day that I was in, I had no idea what they were going to do. And it was all prescribed. And so I think for me, if you have a roadmap, it certainly reduces the stress level. You may not like what you have to go through, but if you know what's coming, you can get yourself ready for it mentally. Mm-hmm. What they did that was great, and I never one time was talking to any of the people on my care team that wouldn't sit and answer every single one of my questions. And that, mm-hmm. As I talk to other people that have gone through this in different places, that's not always the case. And I tried to work for those moments to be respectful with their time rather than, do you have any other questions? Well, let me think about it. No. Sorry. Here's the list of 10 things I was thinking about. So when you walked in the door, I could ask these. Mm-hmm. But never one time did I feel like they were trying to hurry me up or move me along or stop me from asking questions. But that's a huge benefit, right? Mm-hmm. And I think everyone, there's a lot of benefit into being very inquisitive about what's going on.
Mm-hmm. Mm-hmm. Were there policies and procedures in place at the hospital and the treatment center that you felt helped you too? I mean, because what I'm hoping is that hopefully healthcare professionals will listen to this and maybe they'll refer it to their organizations to really see, hey, this helped, this structure helped, this format helped, this didn't help,
Yeah, and I honestly think that's one of the challenges, because a lot of the treatment is compartmentalized, right? So one person doesn't know what the next person is doing or even when it's supposed to happen. So that first day in, come in, have some kind of assessment, get a heart test, get a bone marrow draw. Well, the nurse didn't know that the heart test was ordered, the charge nurse for me. Then the heart test person didn't know what came after that. So there is an opportunity to create a roadmap for people. I think it's hard, and I think it's really a structural problem. Not that any care center is doing anything wrong. It's just more the way they operate.
Yeah.
So I think it's a challenge and an opportunity. And I think what you had mentioned, I'll parrot it again. I think having a consult with somebody from the minute you walk in the door, I think would be huge.
Mm-hmm.
Yeah, I think what you're describing, Jeff, sounds to me like the U.S. medical care system being the labyrinth that it sort of is, and with all the sort of nuanced procedures that have to go on, and they all, and sort of the left hand doesn't always know what the right hand's doing.
Right.
But having said all of that, like you said, if there was some sort of overarching aspect to it that helped the mental side of dealing with such a disruptive thing in life, that would be better. And I suspect that is sort of what drove you to write your book. So let's talk about that. Did the idea for the book come to you when you were going through this experience, or did that happen after?
A little bit of both. So when I was inpatient, I would write a blog to friends and family just to say, here's what's going on. Right. But yeah, I think as I went through it, it just felt like there was something missing. Right. And the way I articulate it to people is, think of your child. Our kids get more training at 5 years old for their first kiddie soccer game than we give to cancer patients the minute after they're diagnosed. That's crazy. It's absolutely insane. And they throw you into the system, and nobody's doing anything wrong. Like I said, the people that looked after me were fabulous to a person. Never once had a challenge, but it's just that there's no department in a hospital that is set up to go and coach people essentially from the get up. Now, if you're having serious mental challenges, obviously there's people that help you, but there's no kind of standard help for people that have started the process and aren't to the point of an acute mental crisis, but could use the help in terms of how they manage themselves.
Well, let me ask you this. Knowing the way that, I've known you, did it look like you were losing it, or were you trying to keep that straight face and handle it while inside you're kind of like that duck on water pedaling like man underneath, while on the top you're looking smooth and cool?
Yeah, probably somewhere in the middle. I certainly wasn't smooth and cool. I can tell you that.
Yeah.
I was
And I think
calm duck. But because I was not, that first day especially, I was not charitable when they kept telling me there was more steps before I could start my treatment. At one point, I'm like, really, this is ridiculous. But it's just how it is. But it wasn't to the point where, again, I saw people on my floor at night just crying or wailing. It's just, it wasn't like that, right, for me. So I wasn't probably bad enough. And I had a lot of people that came to visit me, and a lot of people supported me. So it wasn't like that for me, I don't think. But if it was, I'm sure they would have been Johnny on the spot to get me some support. But I was still struggling mightily in my head.
Yeah. Yeah, and I think that's a lot of it, is that people don't tend to think what's going on beneath the surface. They tend to
Mhm.
look and say, "Oh, this person looks good." It's kind of like triage in that way.
Yeah,
Well, that person looks more, they're bleeding
yeah,
out, and this person's, they're holding their arm over the wound, even though it's internal
yeah,
bleeding kind of thing, you know?
yeah. No, that's a good
So,
analogy. A really good
yeah.
analogy. Yep.
Yeah. So I think, and even so, even in that, for healthcare providers, remember that just because your person looks cool and calm and looks like they have a great
Yep.
support system, they still may need that help to
Yep.
help them to like set up that path. Even,
100%.
especially people who are systems oriented like you. You wanted to know the path. You wanted to understand the process. You wanted to, even though you might have known your prognosis to some degree, what are some things that you can hold on to and some structure you can have that will help to give you a more sense of predictability and calmness in the process.
Yep. And one of the things I tell everyone who's going through this is you just have to advocate for yourself. Really, just advocate for yourself and ask questions, right? So if they don't give you a roadmap, you need to ask enough questions to go and develop it at least as far out as they know, right? So that's
How did you learn what questions to ask?
uh yeah, asking questions really has never been a challenge for me.
Uh-huh. Uh-huh.
um but it was anything I was uncomfortable with. Right. So the very first day I had chemo, there was 4 drugs in my chemo cocktail. So I asked the nurse, I'm like, well, what do these drugs do? She's like, well, this one I think does this, and this one I think does that. And it's not uh, anything on the nurse, right? I mean, Lord knows they know a lot about a lot of things, but they're not experts in how all these cancer drugs are concocted. So I'm like, okay, I'll just call the doctor. Oh, no, 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 we can't. So they ended up sending the pharmacist up to me.
Mm-hmm.
And I just, like anything you're uncomfortable with, ask questions. And I think part of it is there's a reluctancy of a lot of people to quote unquote challenge or ask questions of doctors because they feel dumb, right? Doctors are some of the smartest, well-trained people on the planet. And I unfortunately never had that challenge, but for a lot of people, it's a thing, right? And it's like, look, you have to ask these questions if you want your stress to be reduced as much as possible. You have to. So anything I didn't understand or I was uncomfortable with, or if I didn't know the next 2 steps in the process, I just asked away.
Mm-hmm.
And it wasn't
Excellent.
formulaic; it was just whatever it was. And be smart and respectful. Write it down for your doctor or nurse or whoever. But yeah, ask away. And no questions dumb.
Mm-hmm.
Right?
Yeah, I think that's important to remember, right?
Yeah,
You have to ask those questions. There is no dumb
yeah,
question. And the doctors, right, they may take some things for granted too, because they are so knowledgeable on this. And they probably have, just knowing how the healthcare system runs, they probably have tons of patients that they're attending to all at one time.
yeah,
And, just asking them to slow down for a second and explain what's going on.
yeah,
I think that's pivotal.
yeah. No, you're right. You're right. They're
Uh,
busy.
yeah, absolutely. Jeff, I'm wondering, it sounds like you had a pretty intensive treatment being inpatient for the chemotherapy and then I guess the radiation following that. What were the physical impacts on your body and how did that affect your emotions going through this experience?
Oh, that's a really good question. Um, yeah, so every successive chemo treatment, the effect essentially gets worse, right? So the first one, you're in for 4 days. The first week, you feel okay because they have you on some medicine to kind of transition you. The second week afterwards is generally bad. And it got to the point where I'm lying on the couch. I don't want to move. It's really bad, right? You lose your hair, you lose weight, the whole 9 yards, which it is hard. And I think what you realize is you look in the mirror and you're just like, what is going on? And that sense of not being able to move, not wanting to move, not feeling like you want to do anything, seeing yourself in the mirror, those things can add a huge pile of stress. And I think, you know, the great thing was everyone around me, and especially the doctors, right? They have you focused on your North Star, right? So this is the path to get better. So you just gotta transit it, right? And the extent that you can focus on something just a little bit further out to help you get through that bad day or week or stretch of days. Okay. That's the thing, but it's, there's constant reminders, certainly as you go deeper into the process of, this isn't normal and it's not great, but it's what you have to do.
And did you feel yourself at any point sort of hit the bottom when you're going through that and then starting to improve? I'm not sure exactly how your treatment was engineered, but
yeah,
could you feel sort of like a bottom point and then your body starts recovering, I guess, depending on how they're adjusting the levels of your chemotherapy?
Yeah, for sure. So it was typically the second week after I got out where they keep you on a little bit of meds that first week after you get out. So you're in for essentially a week. You have a week where you're kind of metered off and they're giving you some things to help you support your body. But after that, it was typically the second week after I was in the hospital that was just awful. Like, you don't want to do anything. And the first time, it happens, it's a surprise. And honestly, the doctors don't really know how. Everyone's different, right? So everyone has a different reaction to it. But certainly when the third round is coming, you're like, ugh. And then if you have complications in the meantime, so I had a fever at one point, and of course they freak out when you have a fever because your immune system is mostly gone as they try and kill the cancer. And so, that was a whole nother thing where you kind of feel like, God, can it get any worse? But the kind of seminal moment for me was I had to have a blood transfusion. And that was, I'm lying in bed, chemo, and I just couldn't move. Like, I literally couldn't move. It was awful. So that was the bottom, probably a week or two later, that was really, really the bottom physically. And then after that, it started going up, and even going through radiation wasn't horrible for me.
And in that moment, when you had the blood transfusion, mentally, where were you?
I don't want to say given up, but I was resigned that that needed to happen, because everything, I don't want to say everything, a lot of things are presented as an option. Hey, you're really tired, your blood levels don't look great, maybe you should have a transfusion. And I'm like, well, is there anything else I can do? Because I wasn't real keen on that for a variety of reasons. And so you get to a point you're just like, I'm not winning this, right? Physically, I can't, there's nothing I can do. And you're resigned at that point. It feels like you're giving up because you were trying to say, look, I'm going to try and fight this myself. But there's certain things where you just need some kind of intervention. So,
yeah, it's interesting that you say that you feel almost like you're giving up, but really you may be giving up on like sort of a natural or just a solely mental approach to it, but allowing the medical professionals to do what they need to do, right, is not necessarily giving up. Some people might say if you refused it, that was giving up.
Right. No, 100%. And I would always ask the question, because there were some things that I turned down, some optional treatments. And I said, look, if I'm making a decision here that's medically the stupidest thing you've ever seen, then just tell me to do it. Right. Because I don't know. I don't have a frame of reference. Right.
You're not a doctor.
You need to take a blood thinner. I'm like, well, do I really need to take a blood thinner? Like, why do you do it? What, ask all the questions. And then typically would end up with, look, if I'm doing something really stupid, just tell me, and then we'll move forward and do it. But again, all my treatment people were fabulous with those kind of questions. So, yeah.
So what do you feel like you learned about yourself through going through that whole experience, maybe that you didn't know or realize before?
Ooh, that's a great question. I think my emotional self-awareness improved. So that was one thing. I learned patience. Ironic as a patient, but there's certain times when you just can't push because it's not the right time. So what's an example of that? Early on in my treatment, there were, they knew maybe one or two things that were coming after whatever step I was in, but they didn't know further out for a variety of reasons. And for me to go and push on the doctor to say, well, what's going to happen after that? What's going to happen after that? Sometimes you just have to let the process go. And I'm an impatient person by nature, but I think that helped me understand that not all times are the right time to push. Sometimes it is, but sometimes it's not. And there's good reasons that you shouldn't. So those would be probably two of the things that I learned about myself going through this.
What about your marriage?
Best wife ever.
Yeah.
I mean, she was unbelievably supportive. And that was at a time when we had kids going every which direction with sports and school and everything else. So I think, and you bring up a good point, right? You got to be smart about what the caregiver is going through as well. So you may not, as a patient, have that perspective, but certainly if you're a caregiver, you got to be smart about how you're managing yourself as well. Because I have seen people get burned out trying to manage all that.
Yeah.
And Lord knows my wife was working. Luckily, she was working close by. I could get to the hospital, but chasing kids around and, taking care of the dogs and maintaining the household and all that, it's a lot. So having a supportive partner for me was amazing.
And, we've had episodes, a couple episodes I called The Specificity of Love that talk about all the different definitions of love. In that episode, I talked about how Sanskrit had 96 different words for different types of love. So in that, kind of one of the things I'd want to kind of ask you is, what are the different types of love that you realized your wife had for you and you have for her that were different and deepened your relationship in many ways by going through this?
Yeah, I think you always suspect that your partner that you picked on purpose is going to be for you, with you and there for you no matter what. But I don't think you really know until you go through something like this. And it was, for me, exactly as I expected. So supportive, demanding. Hey, get up. Sorry, you don't feel good. Go walk around the living room. I don't care. Not my problem. Right. Corralling. She herded all the cats that needed to be herded, took care of all the different things, and was there to ask, I think, the right questions at the right time, and never really pushed, but she could tell. I mean, obviously after being married for a long time, when things weren't right, and she would ask and maybe I wouldn't answer her directly, and then she'd come back around in a day or so and ask the same question. So I think it's, seeing that in action when you're under a lot of duress, I think was unsurprising, but amazing for me. I mean, It was great. It was great because it's a lot. I mean, it really is a lot.
Yeah.
As bad as you feel sitting in the hospital bed, all the crazy stuff that go, where do I park? Oh, did I feed the dogs? Where does the kid have to be? What do I have to pay the school fees? Whatever it is, right? So there's a lot going on.
Yeah, talk about things to manage. That suddenly you're managing probably more on the household level, and then managing your situation too. Can't be easy. Yeah.
Yeah, it's a lot.
Jeff, how long ago was it that you went through this ordeal?
So, like 7 years now. So diagnosed 16, 15, 16.
Yeah. And you're in remission, is it? Or are you totally cancer-free?
They're done with me. They think I'm good. So I'm thrilled.
Well, that's great. That's great news.
Yeah. And it's hard for me. I mean, one of the challenging things is it's really hard to tell when people have this type of lymphoma. So that always puts a little thought in the back of your head. It's, you're having a bad day. You feel really tired after a couple of days in a row, and you're like, there's something going on. But I think you just got to let it rip and talk to your doctor if you don't feel right. That's
Were you the type of person who went to your doctor for an annual physical? I mean, guys I know are, I know myself, I'm not as good as I should be. I know that's common with men.
Yeah, I wouldn't say I went annually, but I didn't wait 5 years either. So I would go every couple of years.
Mhm.
And yeah, look, it's one of those things where I wasn't maybe a huge advocate for going to the doctor for every little thing, but now it's just like, if you have the ability to, then go get it checked out. Something's not right, it's not right, go get it checked out. And if it's nothing, great. Right? Because early detection, right? They say it a lot for breast cancer
Yeah.
patients, but for anything really, you never know. And they can find out a lot of stuff about what's going on in your body just through a checkup. So certainly would recommend that.
So how important were visits from friends and, other extended family and things? I know different people are different. It's very idiosyncratic, but for you, I know you wrote about that.
Yeah.
So how important was that for you?
So the support I received was great. It was always a breath of fresh air to have an old friend stop by or a neighbor or whatnot. So it was the pick me up that you needed every single day that you're in there, or you get a phone call or somebody drops off soup at your house or whatever it is. Right? It's one of those things where you talk about the 96 kinds of love. You feel love from your community or from your friends or your family through those visits and through those actions, which to me was huge. The other side of it, though, I think you have to be really smart about people that are there to help you, but add to the stress. Right. So, what's an example? Might be somebody that maybe you don't know very well, and they come and maybe you see them in the grocery store. Oh, how are you doing? Boy, you must really feel terrible. I know what's going through is hard. And so there's people that are trying to help, and a lot of times people honestly don't know what to say.
Mm-hmm.
Right. And they'll say things that set you off in a way for whatever reason. And I think you just have to be smart about how you manage that side as well. So,
Mm-hmm.
and really contemplate and reflect on all the love that you're getting. And if there's people that are trying to be helpful but are adding stress, be smart about that as well.
And Jeff, yeah, I thought that's such a good point. I think that is so common. People don't know what to say to a cancer patient. And I know your book is written about how to be a cancer patient, but what should someone say? Like, what should people not say, and what should they say? Let's say when they run into you out and about at the supermarket or somewhere.
Yeah, I think what to say is, how can I help? You can call me anytime. How can I help you? Let me know what I can do. That's the best, because then it goes and shifts it from you helping on your terms, you helping the patient on your terms, versus them coming to you and saying, here's what would help me on my terms. That's super important. And then some of the things people would say that aren't helpful are trying to commiserate with, boy, that must be really terrible. So that's the last thing somebody who's sick or is going through cancer wants to think about, is how hard it is or how terrible it is or why they have no hair or whatever. That's not really helpful. And again, I have never seen a case where somebody's trying to make those comments out of malice. It's just,
Right.
It's just they're trying to relate in a way that they know is certainly visibly evident, right? So that's the approach. But I think if you just stick to, how can I help? I'm here. Call anytime. Let me know if there's anything I can do for you. Then that's probably the best way to approach it.
So what are the things you're doing in addition to how to be a cancer patient? What are the things that you're out there doing now? I see a lot of your LinkedIn posts and things but to really help this subculture and your fellow patients and families going through these situations.
Yeah. So a lot of that on social media, obviously, just trying to get the word out. Certainly have joined a few organizations, and then also still work. There's a program at the James Cancer Center called the HOPE program, where they match people based on their cancer types, and you're essentially a cancer buddy for somebody. Mm-hmm. So these are people that, for whatever reason, they think that they would like to have a sounding board or additional support or what have you. So that to me has been amazingly rewarding. Between that and comments I get out of the blue, or people that will reach out to me and say, "Hey, my friend is sick. Can you send him a book? And can I give him your number?" I mean, that kind of personal, on the ground stuff to me it's just great. I really know that I'm helping somebody, and that's amazing. So that's kind of the path.
What would you still like to do moving forward? What are some of your goals?
Yeah, so I think as you mentioned, there's an opportunity to create something that is put in the hands or put on the screen in front of a cancer patient 5 minutes after they're diagnosed, that would say, start here, do this, do this, do this. And I think having that groundwork laid right from the point that somebody learns that they're getting ready to go through their own cancer journey, I think would be super helpful. So that's probably on the docket, whether it's a shorter version of the book where it's just almost like a reference guide, or a series of short videos that kind of goes through each of the principles one at a time, so people can transit it, asynchronously.
So what if we did this? What if you and I set up some time to just like on this type of format, to go back and forth and we have a discussion? And I mean, I think part of this podcast could do that, but then submit it to the James and other cancer centers and things and see how it goes.
That would be amazing. If you'd be willing to help with that, it'd be amazing. So. Yeah,
well, it's an honor to help you with your book. So it'd be an honor to help you reach all the people you can and make a difference.
Well, as I told you before, I greatly appreciated the adult supervision on the book. So thank you for that. I'm no author. But I do have a story. So
well, I just play one on TV, right?
Yeah.
And Jeff, speaking of the book, I mean, the title is How to Be a Cancer Patient, but I haven't read it yet. But I suspect, I'm just getting the feeling that this would be helpful even for people who aren't cancer patients. As Dr. E mentioned at the top of this show, American Cancer Society estimates 1 in 3 Americans will be diagnosed. That's 2 in 3 who aren't, but still, you may well know someone who is.
Yeah, for sure. And that's, I just had a friend reach out to me a week ago. His sister-in-law just got diagnosed, and he said, "Look, I bought your book for my sister-in-law. Here's her number. She may call you." And I also got books for her spouse and some of the other people in her family, so they can understand how to try and support her as best as possible. So that, again, I love those stories. It's so great. So not that I have the market cornered on great advice for cancer, or, to your point, any medical patient, but it's just, here's some things that I think will help.
Absolutely. I'm sure you have firsthand experience with it, and you overcame it, which is.
I'd even love to hear from your wife. If we produce it, I'd love to hear from the caretaker side. Get a few words of guidance for her of what she could give to
That's a super smart idea. Yeah, I like that.
Yeah,
because it is a big deal, and there's no roadmap for them either.
Yeah,
no, not at all.
Yeah, and that's a big deal, and it's a lot of stress. So you're certainly more competent in being able to define all the different things that happen, but it's stressful from the highest level, and getting down into the different components of that and how to manage it, I think, would be helpful.
Well, and as I always talk about, every emotion has its purpose. So as we're going through these things, when we get in that place of overwhelm, overwhelm just says, step back. Let's look at all the things before us, break them down into the parts and pieces, see how we can manage each. And what maybe are some we kind of say, okay, I'm going to put you over here for now because this is a priority. So in other words, you're doing triage in on all the different aspects of that situation. But then helplessness lets us know when we need help. Fear lets us know when we might need to do something to
Yeah.
protect ourselves. Hopelessness lets us know when we need to find hope. So in each of those, I know for viewers, I cover them again and again, but I think it's really important to keep reminding people there is a value to every emotion. However, when we feel like life is washed over us like a tidal wave, it's important then to step back and say, okay, what is this here for, and what are these emotions about, and how can I navigate them and manage them more effectively?
No, you're right. You're right. It is hard. It's hard to catch yourself, and it's hard to know what to do. Right. So that's why when you provide advice like that, it's enormously valuable.
I appreciate you being a part of today's discussion.
Oh, of course. I appreciate you allowing me to come on and tell the story a little bit. And like I said, if I help one person today, that's awesome.
Yes. And Jeff, thank you for being so candid and talking about your experience. And I'm sure there's more of that in the book. And hopefully that can help people too.
That's the plan. So
Yeah.
I do get comments and emails from time to time that says, yeah, thank you. So that's, like I said.
Yeah. I bet that feels good.
Yeah. Best part of my day for sure.
Yeah. Excellent.
Well, Jeff Boothman, thank you for joining us today.
Thank you. Appreciate
And
having me.
yeah, and best of luck and best of health to you too.
Thank you.
Yep. Dr. E.
Yeah.
Story.
Good one. Great
Absolutely.
discussion. And I think one thing we didn't talk about, but it's behind this, is the courage it takes for so many people to live through these experiences. Often they didn't know that they had that either. These life happens for us, not to us. I'll keep going back to that. And again, the courage that it takes, not just for Jeff, but for his wife, for his kids, for his family. And we just feel like we're living through those moments. And sometimes it's one breath at a time, but it's another breath we took, and another breath we're closer to learning, to growing, to understanding, no matter what the outcome. And some outcomes, again, they're outcomes that aren't like Jeff's, that people still live through and manage. And I hope that people can even share their stories of growth and resilience, and how they came through some of the stories maybe that didn't have the outcomes that Jeff had.
Yeah, I think courage is a huge part of that resilience, and that's a great point, Dr. E. And it was just really nice to hear from him, and first of all, hear that he conquered it and is in good health today, and just hearing about the challenges. It's not easy, and
No.
I think him being candid about that will certainly help people. And then if they look further into some of his advice, I'm sure they can get even more help.
Absolutely. Well, it's always good to work with you, Andrew, and I always feel blessed to have the guests we've had on. And as usual, I look forward to the next time.
Absolutely.
So, until next time.